Hello friends, I am Dr. R.K. Dua. I am a founder of Fun, Learn and Earn system for the dentist. So in the last video, I have discussed how we can do the percussion and get some information from a swelling on the surface of the body. So this time I will talk about the auscultation. Auscultation means hearing the various kinds of sound from the body cavities through stethoscope. So what exactly we have to listen? So we have to just, the main purpose is to differentiate whether the normal sounds are present or some abnormal sounds are present. Second thing, if abnormal sounds are present, what are their characters? And you can see, although you can also hear the symmetry of the sounds on the both side if we are auscultating the chest. In case of abdomen, we have to check whether the peristaltic movements are normal, abnormal. If these are abnormal, whether they are absent, decreased or totally increased. So we have to listen all these change in the normal sounds through stethoscope. So whenever we auscultate the chest, so we must know what are the normal breath sounds. So you can easily appreciate the normal breath sounds by placing the stethoscope over your own chest or some friend or relative and compare on the both sides. Compare on both sides means if we are placing a stethoscope on the upper third of the chest on the right side, we have to compare the upper third with the left side. Middle third, lower third. So that should not be there if I have placed once I have placed the stethoscope over the right side on the upper third of the chest, and in the next moment I am placing the stethoscope on the right side lower chest. So that will not give exact information that we want to have from the auscultation. So we have to compare one region of the chest at one side with the similar, or you can say the same area on the opposite side, so that we can make out that this part of the chest on the right side or the left side is having some problem. So normal breath sounds we can have. So added sounds may be some whistle like because of the bronchospasm. If fluid is there, it may be crackling sound or rubbing sound because of the inflammation of the pleural surfaces. So in case of abdomen, so in all abdominal surgeries from simple appendicitis, or you can say appendectomy, surgery is appendectomy, to major abdominal surgeries, whenever we open the peritoneum and handle the guts, so these guts go into temporary paralysis. So that means paralysis, if the gut undergoes paralytic movement, so there will be no peristaltic movement and there will be no sound. So these peristaltic movement returns after 48 to 72 hours depending upon the surgical procedure. So sometimes in case of minor surgeries like the appendectomy, the sounds may be present after 24 hours. So until unless we know the normal peristaltic sounds, we will not be able to appreciate what are the abnormal peristaltic sounds are there. So in case of any abdominal surgery, electrolyte imbalance or other medical problems, these gut peristaltic movements may be absent and we can say that we have paralytic ileus without any surgical procedure. So when surgical procedure is there, even then gut loops go into rest and peristaltic movement reverts back after 1 to 2 days depending upon the surgical procedure. So during that time we will not hear any abdominal sound. So there will be no peristaltic movement. So when these peristaltic movement returns, we allow the patient to take orally. So what happens in case of intestinal obstruction? So there is tendency of all the tubular structures like the ureter and the intestine. Whenever there is obstruction, these peristaltic movements tries to relieve the obstruction by repeatedly pushing that obstruction. So in an attempt to relieve the obstruction, there is increase in the peristaltic movements. So we can find that initially in case of obstruction, the peristaltic movements will increase, then keep on decreasing, and ultimately the gut loops, when these gut loops are totally tired, so they will go into rest and we will not be able to hear any sound, and the only indication that will have absent sounds along with the abdominal distension. So it is very essential in the post-operative period to decide whether we should allow the patient orally or not. We should not allow oral intake until unless the bowel sounds are present. So we must know how to auscultate and how to auscultate the chest and how to auscultate the abdomen. So chest I have already discussed. In case of abdomen, we have to place a stethoscope over the abdominal wall on the right or left side, and we have to listen for at least 2 to 3 minutes. It should not be like that these peristaltic movements are continuously going on like a machinery. So these peristaltic movements, we have to place stethoscope constantly over one part and then try to listen the normal sounds. If these sounds are present, that means intestine is normally functioning and we can easily allow the patient orally. Thank you very much.